This is Dr. Victoria Givens, your facial plastic surgeon at Givens Facial Plastic Surgery here in Austin, Texas. And today we're going to be talking about the brow lift. So I have many clients that come in to me really wanting something done because they've had many people, family, friends commenting that they look tired or they look very angry, and they're not. Just over time, what happens is the muscles in the forehead can become very hypercontractile, meaning that they overcontract, causing lots of lines between the hairline and the eyebrows, as well as vertical lines, or what we call the 11s, between the eyebrows. In addition, as gravity takes over, we begin to sag, become heavy, and drop down in the brow region. It usually starts medially and works its way out. And over time, this can produce a very tired, angry look from the wrinkling and from the sagging of the brows. It can also, with enough sagging of the brows, it can push down on the eyelids and create heavy eyelids as well. We'll talk about eyelids separately because we're going to stick with the brow lift today. So the point of a brow lift is to really restore and give a refreshed face. Our goal is not to elevate the eyebrows as high as possible. It's to naturally lift them and decrease the amount of rhytids or wrinkles that go horizontally across the forehead or vertically across the brows. Most of the time, you can make all incisions for a brow lift within the hairline so that they're nice and very well hidden. The caveat to that is if you have someone with or a patient with a very high hairline, meaning a very large forehead, higher setback hair, that you don't want to elevate and push their hairline back anymore, you sometimes need to make a small incision in front of or within the hairline that ends up being very well hidden once surgery is over. But otherwise, incisions usually can just be made in the hairline and the procedure can go forward after that. The goal of the procedure is to make incisions, come down under the skin, and basically make small incisions into the muscle to relax that muscle and prevent it from being hypercontractile and having excessive wrinkling of the skin. And we also will soften by taking out some of the muscle of the corrugator, which runs in this fashion across both eyebrows, as well as the procerus, which is a central muscle here. We don't remove all of it, but we do remove some to allow relaxation, realigning, and decrease in wrinkling overall. After we do that, we will reestablish by elevating just slightly and resuturing in the hairline to allow for just a subtle, gentle elevation of the medial and lateral brows. In younger patients who don't necessarily have very heavy medial brows, sometimes they just need a lateral brow lift. Again, it's a very natural and customized lift, and I always encourage my patients to come in for a one-on-one personal consultation so we can discover what is your aesthetic goals, what your needs are, and your underlying anatomy and the best treatments for you. At that point, we can also discuss what other treatments may be beneficial to you for prophylaxis before, during, or even after treatment, and create a customized and personalized treatment plan. I hope this helps, and if you're ready to transform your life, it's time to call me at 737-787-8200 or email our office at office@givensmd.com. I look forward to seeing you soon.